And with that quick jab, a British grandmother has become the first person in the world outside of a clinical trial to get a Pfizer vaccine. And that first shot ushering in the start of a historic mass vaccination plan across the United Kingdom. Our Europe Bureau Chief Crystal Goomansingh joins us now from London. Crystal, thank you so much for taking the time. I mean, this has been obviously a real major step for the United Kingdom, really for the world. As you know, Britain has been hit very hard with this. It's been described as a marathon, not a sprint, but just characterize the reaction across the UK right now, given all this.
Well, I think that the best word is probably optimism, Anthony. You know, one of the things that we're dealing with here in the UK is the fact that COVID-19 has taken more than 61,000 lives. And the number is actually much higher if you take into account someone that has died, and on their death certificate, the word COVID is included. So the need for a vaccine has been incredibly strong. And, you know, you showed the picture of 90-year-old Maggie Keenan getting the shot in Coventry, England this morning, the very first person to get the COVID-19 vaccine. You know, it happened at 6:30. She was wearing that very sweet little Christmassy T-shirt, and everyone is really thinking about that time right now, thinking, will we be able to get together with family and friends? Will we be able to embrace and see each other? But we're not there yet. We have heard from the Prime Minister, Boris Johnson, along with Britain's Health Secretary, Matt Hancock, and officials right across the UK who are all saying that this is the beginning of the end of the pandemic here in the United Kingdom. But it is not the end of the pandemic, Anthony. You know, we're starting the vaccine rollout, but it will take weeks, even potentially months, just to get through the first priority group.
So try to give us a sense of what is next in terms of this massive rollout, how it's going to work, where it's going to go, and who is going to be affected by it.
Yeah, this is really important. So it is starting here in the UK. Officials are sort of putting that priority to the group that they say is most at risk of dying from COVID-19. So we're talking about older individuals, people in high-risk categories, just like Marianne was talking about in Canada. They are going to be looking at people in care homes as well as care home workers. However, because this vaccine comes with challenges, it's not the easiest vaccine to deal with. The Pfizer BioNTech vaccine has to be kept at incredibly cold temperatures, minus 70 degrees Celsius, and it also comes in larger batches. So they weren't able to take it right to personal care homes and smaller locations. That's why the first round of vaccinations is happening at hospitals, and that's why we're here today out in front of St. Thomas's Hospital, because it's one of the 50 hospital locations. So it'll be a slow process from the hospital settings where we see that priority group, the over 80 population getting the vaccines, and then slowly, officials are saying maybe within a week and a half, 2 weeks, they'll be able to figure out how to break down the vaccine, keep it cold enough, and get it out to other locations. And that's when you'll see more of the population being vaccinated. But this first group, the first priority group, could take weeks, months, and it'll likely be until the spring before there's a good majority of the population that's even been vaccinated. And you have to keep in mind, with this vaccine, you need 2 doses, 21 days apart, and then it's about a week after that second dose that you're said to be, you know, have the highest level of immunity against COVID-19.
And that's an important part of the story as well. Underscores why this is a marathon, but at least the marathon has begun. Crystal, thank you so much. Crystal Goomansingh joining us from London.